Another story making headlines is a new treatment option for patients with hepatitis C. Hometown Health was on hand for a professional seminar hosted by Advanced Gastroenterology and Surgery Associates at their Clermont office.
Chronic hepatitis C has sort of come to the forefront of medicine over the past several years. We know that the most common reason for liver transplantation in this country is for hepatitis C. And recently, last year, we had approval of what's called direct-acting antiviral therapy, which has markedly improved the efficacy of treating the hardest genotype, genotype 1 of the hepatitis C virus. And also, more recently, in the last several months, the CDC has released recommendations of the baby boomers, people born between 1945 to 1965, to routinely have their blood tested for hepatitis C, regardless of any other risk factors or even with normal liver function tests. And the reason this has come to light is that what we've observed over the past few decades is that people born between 1945 to 1965 have 5 times the incidence of hepatitis C than people born in other decades. During that period of time, people were a bit more, I guess, liberal. There was more increased usage of intravenous drugs and paraphernalia like that. And that's the reason that we suspect that group has a high incidence of hepatitis C. Also, anyone who had a blood transfusion prior to 1992 would have been at high risk to attain the virus. The vast majority of patients with hepatitis C are what we call asymptomatic. They have no idea that they have the virus. You know, they may have very mild fatigue, sort of mild myalgias, somewhat like the common flu. However, the vast majority have no symptoms at all. And that is why many of our patients, we ultimately diagnose them when they already have advanced liver disease with cirrhosis. Patients will come in with complications of cirrhosis and found to have hepatitis C, and they never knew that they had it, and they were probably exposed to the virus 20, 30 years ago. So it's a very silent disease. It is much more common in the country right now compared to hepatitis B or even HIV. And the potential with hepatitis C is that we can, with the current therapy, eradicate the virus. Whereas with hepatitis B and HIV, the viruses are suppressed. They're not eradicated completely. So the chances of actually getting rid of this virus is a good thing.
It's estimated that 4.5 million Americans are infected with hepatitis C, 4 to 5 times more than those affected with HIV, making it one of the greatest public health threats of this century. For more information on the treatments and surgical procedures available at AGSA, please click the Hepatitis C Advances story link on our homepage, yourhometownhealth.com.